Part 2. And we're beginning here with endocarditis, which is inflammation of the inner lining of the heart. When there is inflammation of the inner lining of the heart, that's the endocardium, the material that forms the endocardium also forms the valves. So when there's inflammation of the endocardium, there's inflammation of the heart valves. Endocarditis. It's usually bacterial, and it's usually due to a bacterial infection somewhere else in the body that has originated somewhere else in the body. In your book, they show pictures of lungs, a respiratory infection, a dental infection, like an abscess tooth, a kidney or urinary tract infection, a skin infection. The bacteria has gained access to the body through some route and has been carried to the inner lining of the heart. As far as the symptoms of endocarditis, they're really not clear. The person that has endocarditis is going to have very vague, fever, chills, some weakness, anorexia, lack of appetite, and fatigue, like I said. The thing about endocarditis is that there's a certain group of individuals that are more likely to develop endocarditis. And those are people with an already damaged heart valve. Someone that has a congenital defect of a heart valve. Or someone that had rheumatic fever as a child and has developed a heart valve defect. Someone that has mitral valve prolapse. Anyone that has any type of damage or disease of their heart valve, those are the people more likely to develop endocarditis. Those are the people that take prophylactic antibiotics before dental work is performed, to truly do all they can to prevent an infection from invading their body that may be carried to the endocardium. In any invasive procedure they have, they are given antibiotics or prescribed antibiotics. Now, the person that develops the bacterial endocarditis, their valve is referred to as developing a vegetation. I'm showing a picture here of the vegetation, and I know it's very difficult because you don't even know what a normal mitral valve looks like to identify the vegetation. I compare it to a piece of broccoli with the little flowerets of the broccoli that if you hold them under water, the little pieces kind of break off. And the inside of the heart valves get this look of, I want to use broccoli as the example, but what I'm trying to say is that when the blood pushes through these heart valves, little pieces of it are likely to break off like the broccoli under strong flowing water. These little pieces of vegetation break off, and when they break off, they enter the bloodstream. And when they're in the bloodstream, they're flowing through, and they have the likelihood of stopping in a narrow vessel. Could be a narrow vessel of the brain, resulting in a stroke or a cerebrovascular accident. The person that has endocarditis, they have an inflammation of the inner lining of the heart, and it's due to bacteria, so they need antibiotics. They need powerful antibiotics that will cure their infection, and then they need the observation and echocardiograms done to determine if vegetations have formed there. Now, rheumatic fever. The disease itself, rheumatic fever, is due to a strep infection that has not completely been treated or improperly treated, like a strep throat infection. These days, if we have strep throat, we have such pain of our throat and such inflammation that we'll usually go pretty quickly and get antibiotics. And those antibiotics, some are meant to be taken for 5 full days, some 7, some 10. It's very important that the antibiotics are taken for the complete treatment. If the disease, the strep infection, is improperly or incompletely treated, the person may end up with rheumatic fever, where they have this inflammation of their joints and even inflammation of cardiac cardiac tissue. Years ago, before antibiotics were so commonly used, like when my mother was a child, she had rheumatic fever. She remembers the strep throat. She remembers the swollen joints. She remembers not being able to get out of bed for weeks from the pain associated with rheumatic fever. And what she did not know was going on is that her heart tissue was actually affected. And the problem with the heart tissue did not show up until years and years later. And it showed up in the form of valvular disease. Rheumatic fever is the most common cause of heart valve disease. Okay, with the rheumatic fever itself, that's the joint pain, the edema, the redness, the limited range of motion for the joints. Cardiac murmurs may occur, cardiomegaly, and the rheumatic heart disease involves the valves. When we're talking about damage to heart valves, it's either stenosis or it's an incompetence of the valves. If it's stenosis, the valves are narrow. They're more narrow than they should be. In the incompetence, they're more open than they should be. When we're looking at disease of the heart valves, if it's serious enough, they may have heart valve replacement. And there are artificial heart valves. There's pictures here of the artificial heart valves that may be used. Certainly, if they have any type of heart valve damage, they must have those prophylactic antibiotics before dental or invasive procedures to prevent the endocarditis. Okay, the purpose of the heart valve. Go back and review the anatomy of the system. Look in your book at these pictures of the heart and remind yourself that between the left atrium and the left ventricle is a mitral valve. When the heart pushes blood out of the left ventricle, it goes through the aorta, and it must pass through the aortic valve. On the right side of the heart is the tricuspid valve between the right atrium and the right ventricle. The pulmonary valve, the blood is pushed out of the right ventricle through the pulmonary artery, and there's a valve there. These valves all function to keep the blood flowing one direction. Valves prevent backflow of blood. They assure the blood moves one direction through the heart. From the left atrium down to the left ventricle, pushed out the aorta. From the right atrium to the right ventricle, out the pulmonary artery. If someone has stenosis, the valve opening is very narrow, too small for sufficient blood flow. If the person has insufficiency, the valve opening is too large and blood will flow backwards. As far as diagnosing valvular diseases, EKGs, chest x-rays are used, but the very best is the echocardiogram because it will show the motion of those heart valves. Cardiac catheterization may also be used. This is an excellent diagram to show how the blood should be flowing one direction. The blood now is in the right atrium to the right ventricle, out the pulmonary artery. When it leaves the lungs, it's going to come back into the left side of the heart, which it is now, left atrium, left ventricle, out the aorta. And what they're showing here is that there is a leaky mitral valve that allows the blood to kind of flow backwards. Let me get it to the left atrium again. And then when the left ventricle contracts, the blood comes back into the left atrium. And there's also a narrowed aortic valve that right there, it's really hard for the blood to push through because there's narrowing there. Mitral valve stenosis. After a long period of time of having mitral valve stenosis, eventually the heart's going to fail. It's going to overwork until it is exhausted. When a person has mitral valve stenosis, the blood flow is much slower through the heart, which increases the risk risk of thrombus, these little blood clots forming inside the heart. And when those little blood clots and thrombus forms inside the heart, it's very likely that that little blood clot's going to get pushed straight out the aorta, and then it may go straight up the carotids to the brain, causing a stroke. Very important that when a person has mitral valve stenosis, they're on anticoagulants to prevent that blood clot formation. And that they're on medications to reduce the workload of the heart, and they may need the surgery, the replacement of the valve. In mitral valve insufficiency, it's also called incompetence or regurgitation. The mitral valve opens too far and the blood will leak backwards. With the heart valve problems, a murmur is heard, an abnormal heart sound as the blood flows abnormally. Treatment, bed rest, oxygen therapy, antibiotics again to prevent infection. Surgery may be used to replace the valve. Mitral valve prolapse. This term may be familiar to many of you. This is a condition that occurs in otherwise healthy young women. Yes, men can have mitral valve prolapse, but it's just not very common. It's much more common in women who are otherwise healthy. Also called floppy valve syndrome, Klick-Merber syndrome, Barlow syndrome, MVP, mitral valve prolapse. The person may be examined by a physician, just a routine exam, and the physician may hear a murmur, an abnormal heart sound. And then they should send the patient for an echocardiogram. And that echocardiogram should confirm the improper closure of the mitral valve. The mitral valve in mitral valve prolapse is enlarged and kind of drops down back into the left atrium. Usually asymptomatic. Some people will have chest pain or dyspnea or dizziness or fatigue or anxiety. Some even have syncope. If it's symptomatic, they certainly need treatment. But if not, if it's not symptomatic, asymptomatic, no symptoms, then they pretty much just need that prophylactic antibiotic before having dental procedures to prevent endocarditis. Disorders of heart rate or rhythm. Okay, I want to show you the term arrhythmia first of all. Arrhythmia means without heart rhythm. There's another term for that, which is dysrhythmia, abnormal heart rhythm. Disorders of heart rhythm. What you want, what is normal, completely normal heart rhythm is sinus rhythm. And you want your heart to be in sinus rhythm. That is the normal rhythm. If you have an arrhythmia or dysrhythmia, abnormal heart rate, you'll usually have palpitations and you'll feel your heart just pounding in your chest. You'll have a very fast heart rate or a very slow heart rate. The rapid heartbeat is tachycardia. The slow heart rate is bradycardia. You may have skipped heartbeats. You may have syncope because of an arrhythmia. The type of arrhythmia that you have is going to determine the treatment. There is a table in your book that shows arrhythmias, the types, the symptoms and signs, the etiology, the diagnosis, and treatment. Now the first one there is listing normal sinus rhythm. That's not an arrhythmia. That is what's normal. Sinus tachycardia I just mentioned. The sinus tachycardia is when the heart is beating really fast, greater than 100 beats per minute. What's normal is 60 to 100. Bradycardia is beating too slow, less than 60 beats per minute. Alright, I'm not asking you to know about all these arrhythmias, but I do want you to know about atrial fibrillation. In atrial fibrillation, the heart is beating very rapidly with ineffectual, irregular contractions. We're talking 350 beats per minute or more. And this is what the EKG strip looks like when the person's in atrial fibrillation. Also abbreviated AFib or atrial fib, afibrillation, atrial fibrillation. The atria are rapidly contracting at an irregular rate. When a They may be able to take medications to convert them back to a normal rhythm. Or they may need that mechanical defibrillation, which you've seen on ER or other emergency shows where they use the paddles to the person's chest. They actually, with those paddles, stop the heart from beating just for a second with an electrical current, and then it should begin beating again at a normal rhythm. That's the hope with defibrillation. So atrial fibrillation, they need to convert back to normal sinus rhythm. Now another arrhythmia I want you to know about is ventricular fibrillation. This is actually more severe than the atrial fibrillation. And ventricular fibrillation is going to be fatal unless it is reversed by electric defibrillation. Now, when I talk about defibrillation and what you've seen in the shows or the TV with the emergency shows, now we have a defibrillator machine that is compact, and they're starting to have these defibrillators available in airports and malls. In fact, our school now has defibrillators on campus. That if a person is known to be in ventricular fibrillation, that their ventricles are contracting so fast that they're twitching instead of contracting, they can't pump blood around. These people need immediate life-saving electric defibrillation, and we now have equipment on campus to provide that. This is what the EKG strip, the electrocardiogram strip looks like, or the reading there, the picture. Ventricular fibrillation is going to be fatal unless it is reversed. It can result in the cardiac arrest and death. Okay, so I'm not asking you to know about all the different types of arrhythmias, just the ones that I've highlighted here on the slides. Now we're going to look at shock, listed as a life-threatening emergency. When a person's in shock, their cardiovascular system collapses. They have a decrease in the amount of blood that's effectively circulating in the blood. And there's some descriptions given on this slide of how the eyes have a vacant look, lackluster, the breathing is shallow and irregular, the skin is pale and cold and moist, described as cold and clammy. Pulse again, rapid but weak pulse, rapid and shallow breathing, anxiety, the irritability, dizziness, extreme thirst, profuse sweating. In the later stages of shock, the person's pupils will dilate and the patient trembles. I want you to know about these different types of shock. First, the anaphylactic shock. Due to a severe allergic reaction. In anaphylactic shock, the person's allergic reaction is so severe that their airways begin to swell to the point that they cannot breathe. They need immediate life-saving treatment. The hemorrhagic shock, also called hypovolemic shock, the person loses so much blood or so much fluid that their cardiovascular system's collapsing. The septic shock, they have such severe infection in their body, in every system and through their blood, septicemia, they're going to go into shock because of the severe infection. And then the cardiogenic shock. In the cardiogenic shock, these people are having a myocardial infarction and their heart can no longer pump the blood that's needed to be pumped through their body. Now, shock is certainly an emergency. When a person's in shock, it is a life-threatening emergency. And they describe some of the treatments for a person in shock. And it is certainly appropriate that an airway is established, that you establish that they're breathing and the blood is still circulating. It's very important that they be treated immediately because as their cardiovascular system has collapsed, their major organs are no longer receiving blood and oxygen supply. In the cases of the shock, it's very important that the emergency medical responders understand the type of shock and treat appropriately. Like the anaphylactic shock, it's part of an allergic reaction. They need some epinephrine really fast. They need something like Benadryl. IV Benadryl really fast. Hemorrhagic shock, they're losing blood. They need an IV started right away to bring fluids. Their heart has stopped pumping and they can't stand any more fluid. They have fluid overload. So it's really important that the time of shock is clearly identified to determine the appropriate treatment. There's a really good picture in your book showing normal circulation, hypovolemic shock, the cardiogenic shock, and the vascular shock. Okay, I'm going to skip over a couple conditions and talk about conditions of the veins. This is under vascular conditions, and truly thrombosis is not described in your book, but I thought it should be, so I've added it. Thrombosis, formation of a blood clot on a blood vessel wall. Now, formation of a blood clot is a good thing when you need it. When you are cut, or if you have surgery, you're cut in surgery or an accident, you need blood clots to form so you won't lose blood. But then there are cases where a blood clot forms where it's not needed. Like in the case of this patient, that person's got a blood clot in their leg. These blood clots, this condition of thrombosis, is caused by blood that moves too slowly through the vessels. Blood clots, thrombosis can also be caused by a change in the vessel wall. When atherosclerosis, that fatty material accumulates on the vessel wall, platelets stick to it. Blood clots form. A thrombosis may also result from a change in the blood itself. The blood becomes too thick. There are conditions in which people have too many red blood cells. Change in the blood itself. It's much more common that a thrombosis is going to occur in a vein instead of an artery. The blood naturally flows slower through the veins than arteries. So veins are certainly the most common site of thrombus formation. When we refer to the term stasis, that's a slowing of circulation. In people who are inactive or immobilized, they're not moving their legs like they should, the circulation slows so completely, they have stasis, they're very likely to form blood clots in those immobilized parts of the body. Very important is someone that has formed a blood clot where it's not needed receives anticoagulant therapy, maybe in the form of heparin or maybe in the form of sodium warfarin or Coumadin, and they may stay on that anticoagulant for a long period of time to prevent additional thrombi from forming. Okay, now the embolism. The embolism is described in your book. Actually, they use the term emboli, which means more than one. This is what an embolism is. A complication of a thrombosis results when the thrombus becomes detached from the vessel wall and enters the bloodstream as a floating body known as an embolus. Now, I do have to say that a thrombosis, a blood clot floating through the bloodstream, is just one type of embolus. There are other types that I'll talk about on a later occasion. The thrombus, for instance, that forms in the leg, like you saw on the previous screen, the thrombus that forms in the leg, they become detached from its point of formation by rough handling, by massage, by some movement of the leg in the wrong way. And when that clot is detached from its point in the leg, it moves straight up the vessels and has a good chance of going through the heart and ending up in the lungs or the brain or some other site. While it's flowing through the body, it's known as an embolus. The detachment is especially likely when there is infection at the site of the clot. If there's infection at the site of the clot, it's a septic embolism. It has infectious material in it. Again, the detachment is more likely if the site of the clot is handled roughly or massaged. That's a lesson for the physical therapy assistant, for the PTA that may be taking this class. You must evaluate the patient for any signs or symptoms of having a blood clot so that you don't become the one that detaches it through your treatment and cause it to move through the bloodstream in the form of an embolism and stopping in a more vital organ. In the area of the embolus where atherosclerosis earlier, I was talking in reference to the coronary artery disease, just atherosclerosis in the coronary arteries. Now I'm going to talk about atherosclerosis in general. And atherosclerosis is actually a form of arteriosclerosis. Arteriosclerosis is the heading here, and it's referred to as a group of diseases. There are 3 forms of arteriosclerosis, but by far the most common form is atherosclerosis. Very often, when we find documentation in the record, the healthcare worker will use these terms interchangeably, arteriosclerosis and atherosclerosis. They really should not be used interchangeably. Atherosclerosis is specifically referring to the fatty material, the fatty deposits on the inside of the vessel wall. And this is an actual picture of the fatty material on the inside of a vessel wall. Will cause the narrowing of the vessel, the narrowing of the lumen of the vessel. Atherosclerosis is usually asymptomatic until it is advanced, and then the symptoms depend on where the atherosclerosis has formed. If we're talking about in the coronary artery, they'll have angina. If we're talking about maybe the carotid artery that carries the oxygen-rich blood to the brain, they may have dizziness. Atherosclerosis can occur in any vessel in the body, any artery in the body. And the signs and symptoms depend on where it has occurred, where it is formed. This picture shows the different stages of the atherosclerosis, building from just the thin layer to thicker and thicker to where it actually causes blocking of the lumen of the artery. These lipid deposits, these fat deposits are mostly cholesterol, and they're due to the person's diet again, due to exercise, due to smoking, due to diabetes mellitus. That atherosclerosis will lead to ischemia, the decreased blood supply to the tissue, and that ischemia, that decreased blood supply to the tissue, leads to infarction. And infarction is the actual death of the tissue. Tissue necrosis, infarction. Either way, we're talking about dead tissue there that's lost its oxygen and blood supply. The risk factors. I've included a picture here because so much of the risk of atherosclerosis depends on your heredity, on whether your mom and dad and grandmother and grandma had, or grandfather had atherosclerosis. This is an inherited factor. The incidence increases with age. It certainly progresses more rapidly in postmenopausal women because of the decrease in estrogen. And I make the statement it's more common in affluent societies. Affluent societies, those are rich societies. The United States is considered to be an affluent society, and why would atherosclerosis be more common in this affluent society? Mostly because of our diet. Our diet is rich in red meat. Our diet is rich in fast food and fried food, because we can afford it as a more affluent society. It's certainly more severe in those with hypertension and those with diabetes mellitus. The good news about that atherosclerotic plaque is that it is reversible. Now, certainly, heredity is not reversible, okay? Yeah, what you have coded in your DNA, you have coded in your DNA, but especially if you know that you have the risk factors because of inheritance factors, you need to do all you can to reverse the other factors. Stop smoking. Get on a diet that's low in cholesterol. Lose weight. Start exercising. Practice stress reduction techniques. If you can control the controllable risk factors, you can reverse that atherosclerotic material that's formed inside your vessels. And then there's those medications that are helpful, like the medications like Mevacor and Lipitor, the cholesterol-lowering drugs. It's very important that you control and prevent what you can as far as the atherosclerosis, that you become educated. so important in reducing atherosclerosis. Next is a description of aneurysm, and they've got an excellent picture in the book and excellent picture here of a ruptured aortic aneurysm. An aneurysm is a weakening of the wall of a blood vessel. Maybe due to disease, it may be a congenital defect, maybe some form of injury. I compare this to the vessel wall to the wall of a balloon. Like if we took just a regular balloon and we were blowing up the balloon and we put more and more pressure inside the balloon, the wall of the balloon would become thinner and thinner, and if we keep blowing, we keep putting pressure in there, eventually the wall of that balloon is going to rupture. With the aneurysm, the defect is there, whether it's because of a disease like atherosclerosis or a congenital defect, the defect is there. If our blood pressure is increased, more and more pressure may eventually cause that aneurysm to rupture. The aneurysm itself is usually asymptomatic, and they usually don't even know they have it until it ruptures or until it's identified kind of incidentally on some type of imaging like a CAT scan. The rupture is certainly going to be associated with major hemorrhage, and the person's going to need emergency treatment to stop that hemorrhaging. Atherosclerosis is the most common cause. The treatment is all about the location, the size, and the probability of the rupture. Maybe you've heard of people with brain aneurysms. Yes, certainly there are people who die of brain aneurysms where they rupture suddenly and they cannot get to the medical care they need to stop the bleeding. There are people who have the aneurysm of the brain identified on a CAT scan. Sometimes they can treat it with surgery, sometimes they cannot. It depends on the location, the size. And again, whether they're going to do brain surgery depends on the probability of rupture. The aneurysm. Okay, now diseases of the veins. The first disease of the vein described here is phlebitis, which is inflammation of a vein, which usually occurs in the leg. And we're showing here a case in which the catheter, an IV, is in the person's hand. They may actually develop phlebitis because of the inflammation of a vein. The inflammation of a vein with thrombus formation, the inflammation's there, and the blood clot forms in the area. Varicose veins. You see a pretty serious picture there in the middle of varicose veins, swollen, painful, twisted veins of the legs. And the other picture there, those are varicose veins of the esophagus. They're called esophageal varices. And I covered those back in the chapter on the digestive system. Anemia. Anemia is a reduction in the number of erythrocytes or a reduction in the amount of hemoglobin. Okay, as far as erythrocytes, these are red blood cells. And for red blood cells to do their job, which is to carry oxygen around to all parts of the body, hemoglobin must be present. So if the person has enough erythrocytes but a low amount of hemoglobin, they cannot carry the oxygen to all parts of the body. If they have a reduced number of erythrocytes, they cannot carry oxygen to all parts of the body. Anemia. Signs and symptoms. Lack of normal color. The person will appear very pale. Mucous membranes will be very light in color. The nail beds will be very pale. Fatigue, muscle weakness, dyspnea. They'll have palpitations and vertigo or dizziness, headache, syncope, fainting. All of these are signs and symptoms of anemia, or the person may have a slight anemia where they're really asymptomatic. There are many, many different types of anemia. The first one listed here is iron deficiency anemia. In iron deficiency anemia, certainly the person is deficient in iron, and iron is very important for the red blood cells to form properly. The treatment of iron deficiency anemia would be adding iron to the diet. That's the most common type of anemia. Then there's pernicious anemia that I described in one of the earlier chapters. factor of the stomach and the gastric juices. Therefore, they cannot absorb vitamin B12 from the digestive system and get the vitamin B12 into the bloodstream, where B12 is used to make erythrocytes. Vitamin B12 is essential for the red blood cells to mature. So if you don't have the intrinsic factor to allow the absorption of B12 from the digestive tract, you can't get the B12 to the red blood cells to mature them. These people need to be treated with injections of vitamin B12. And then there's aplastic anemia. In aplastic anemia, there is failure of development of the blood cells from the bone marrow. This is certainly a very severe type of anemia in that with failure of the bone marrow, they lack erythrocytes, leukocytes, and the blood clotting cells. They have a deficiency of all types of blood cells. And then there's sickle cell anemia. Very specifically, sickle cell anemia is an inherited type of anemia. And sickle cell anemia is chronic hereditary hemolytic form of anemia, found predominantly in those of the black race. The blood cells, the red blood cells, should have a specific shape, normal shape. In sickle cell anemia, they are abnormally shaped. There's an excellent picture in the book and on this slide to show you this sickle-shaped red blood cell. They're destroyed very easily. They're destroyed as they're so fragile as they go through the bloodstream, hence the name hemolytic anemia. Hemolytic anemia, there's destruction of red blood cells. Sickle cell anemia is a type of hemolytic anemia. Spherocytic anemia, the red blood cells are shaped round like balls, and they're very easily destroyed in the bloodstream. Erythroblastosis fetalis was described earlier in another chapter where red blood cells of the fetus are destroyed. Blood loss anemia may be acute or chronic. And then there's secondary anemia, where the person is known to have another disease, such as chronic renal failure, that results in the anemia. You must have normal kidney function and production of erythropoietin, a hormone that causes red blood cells to mature, to have the proper number of red blood cells. So the secondary anemia is very clearly due to another cause such as kidney disease or leukemia or certain forms of cancer treatment. In diagnosing anemia, it's very important that a complete blood count is done, and that test should be performed in such a way that the amount of hemoglobin is measured, the hematocrit, the white blood cells are counted, the red blood cells are counted. When someone is identified as having anemia, a deficiency of red blood cells, they must determine the cause. It may be a cause that can be treated with iron pills. It may be a cause that has to be further evaluated. Maybe it's caused by abnormally shaped red blood cells, and a red blood cell morphology must be done to determine, are they sickle-shaped? Are they round like balls? Very important to identify the exact type of anemia to know the exact treatment. Blood transfusions would certainly be used for severe anemia, acute cases of anemia. Bone marrow transplants may be needed. Vitamin B12 if we're dealing with pernicious anemia. This concludes Chapter 10, Part 2.